Cirrhosis is a chronic disease that affects which organ? A. Liver. B. Kidney. C. Heart. D. Small intestine. The answer is A. Liver. Cirrhosis is a chronic liver disease, usually caused by alcoholism. It is characterized by fibrosis and destruction of the normal liver tissue. Patients who have cirrhosis may have hepatomegaly on physical exam, which is enlargement of the liver. For example, it may be felt on the abdomen. Which of the following describes a calcium carbonate preparation? A. Rapid acting, releases carbon dioxide in the stomach, causing belching and flatulence. B. Rapid onset and liberates carbon dioxide, increases intra-abdominal pressure and promotes flatulence. C. Slow acting, contains significant amounts of sodium. D. Rapid acting, is also a saline laxative. The answer is A. Rapid acting, releases carbon dioxide in the stomach, causing belching and flatulence. Calcium carbonate preparation is rapid acting, releasing carbon dioxide in the stomach, causing belching and flatulence. Calcium carbonate is an antacid which reacts quickly with HCl to form calcium chloride and carbon dioxide. Which of the following does the nurse not recognize as a medication regimen for treating Helicobacter pylori infections? A. Triple therapy metronidazole, omeprazole plus clarithromycin. B. Dual therapy ranitidine bismuth citrate plus clarithromycin, omeprazole plus clarithromycin. C. Quadruple therapy colloidal bismuth subnitrate, tetracycline, metronidazole plus omeprazole. D. Single therapy colstipol. The answer is D. Single therapy colstipol. Multiple therapies are required to treat Helicobacter pylori infections. Colstipol is a bile acid sequestrant used to lower blood cholesterol, which is not used to treat Helicobacter pylori infections, a bacterium that colonizes the human stomach. What foods must be avoided in celiac disease? A. Foods containing gluten. B. Foods containing dairy. C. Foods containing red meat. D. Foods containing oat. E. Foods containing wheat. The answer is A. Foods containing gluten. Celiac disease is an autoimmune condition that is triggered by ingestion of gluten, a protein found in wheat, barley, and rye. A wheat-free diet is not sufficient for a patient with celiac disease, as many other products contain elements of barley or rye and thus also contain gluten. Oat, while often avoided by individuals with celiac disease due to cross-contamination during processing, does not contain gluten. Whole dairy products are also generally gluten-free and considered safe for patients with celiac disease. Samantha is a registered nurse working in the intensive care unit with a patient recently diagnosed with Clostridium difficile. She violates Clostridium difficile contact precautions by A. Donning only gloves and a gown before entering the room. B. Placing the client in a semi-private room with another patient diagnosed with Clostridium difficile. C. Placing the patient in a private room. D. Cleansing her hands with only alcohol-based gel before leaving the room. E. Cleaning surfaces with hypochlorite-based disinfectants. The answer is D. cleansing her hands with only alcohol-based gel before leaving the room. Clostridium difficile, C. diff, is an infection caused by Clostridium difficile bacteria and requires contact precautions. Contact precautions state that nurses must wear gloves and a gown while caring for the patient. Nurses must also perform adequate hand hygiene before and after the use of gloves. Additionally, because C. diff infections are caused by spores, alcohol gel alone may not be sufficient to eliminate the bacteria. Current practice is the use of soap and water to cleanse hands. Afterwards, nurses may utilize alcohol-based hand gel. It is acceptable to place a C. diff patient in a semi-private room with another C. diff patient if private rooms are unavailable.